Hey guys, Dr. Randy. I got Jeff on traction here, so I wanted to shoot a quick video because we know him. He's had an MRI. He's had several MRIs. He has a history of low back pain, history of neuropathy, but he has herniated discs. He has stenosis. He's been to orthopedic. You know, we're going to see how he progresses, but he had a flare-up where you were getting what, radiating leg pain into the groin, right? He was getting a lot of radiating symptoms from a flare-up of his disc. You did just something. What would you do?
Oh, I was just had my leg bent up and trying to raise my
just
foot.
Just something he's done a million times,
Yeah.
and we see this a lot. Patients that are doing what's called an activity of daily living, nothing that should really throw anything off, but they end up with a major problem because of it. And it wasn't that instant. We know it was the history, and it was the old injuries that he has in his back. Anyway, so he came in and we did some light adjustment, very light adjustment. We did traction. It really helped him some. It took away some leg pain. So I want to just show you how this works. It's a decompression table. We have his legs elevated. We have the belt. It pulls, and we just had it on a little bit too high for him. We turned it down, so we can pull. We can change the weight that it pulls. It pulls for 30 seconds at a heavier pressure, and then relaxes for 10 seconds, and then this part holds his upper body up. So if you're at home and you're watching and you're getting, he's getting shooting pain down his legs, he's getting groin pain radiating from his low back. But yesterday he came in and did the traction. It really helped, so he's back in and do it today. What can happen again is that disc can herniate and can irritate that nerve. We call that a hot disc. That is extremely tender, and that nerve is very delicate. So what the decompression does is it pulls those vertebrae apart and allows that herniated disc to sort of come back into the center of that vertebrae as opposed to being herniated out to the side and hitting a spinal nerve. Now, he also has stenosis, which is degeneration and scar tissue buildup on the inside of his canal. So that's hitting his spinal cord essentially. It's arthritis around the cord that's giving him bilateral leg symptoms, in this case into his groin. So that's something that's a little bit different. The decompression can help with that, but it's really meant for herniated, bulging, irritated discs. Getting adjusted very lightly in our regular treatments that we've done in the office with the soft tissue and the drop work, all is good for bad discs too. If somebody else coming in now with a bad disc, that we're just treating that way and not with the traction table. But this is something that we have, a tool we have at our disposal that I think works really well for bad discs. So I just wanted to point that out, and that's it. Hopefully we can continue to get him some relief and get him back moving around again better. So thanks.